My Plan F premiums have risen by 15% per year over the past 4 years I've been with Aetna. I'm used to rising yearly premiums, and shopping for Medigap plans isn't easy when you're under 65 like me. I assumed rates increased equally for everyone in my age group and zip code, but was shocked to find that new members are paying $55 less per month than I'm paying. Rather than everyone in the same demographic paying the same rate, the longer you stay with the plan, the more you're paying relative to others with the same plan. From now on, I'll put more effort into checking out different plans every year. Is this practice even legal?
At the risk of sounding like I'm apologizing for something, because I know what you're saying is correct, the way that you're seeing it. There's a couple things in the insurance world that cannot happen. And one is that, but there's explanations for why it appears to be happening. Now, I feel like I'm double talking and all this. Just stay with me. So, when you say, I have a policy with Aetna, well, I can tell you that Medigap 360 is licensed to sell policies for Aetna. Now, which Aetna are we talking about? Are we talking about the Continental Life policy, the Brentwood company? Are we talking about Aetna Life and Health Insurance Company, or another Aetna subsidiary that's all that? So you have the Aetna brand, and they own different insurance companies, and they are actually, legal entities that are their own themselves. And the Department of Insurance will look at each one of these as a different entity. So the same thing with Mutual of Omaha. Well, I have a policy with Mutual of Omaha, but your card says United of Omaha, or it says Omaha Insurance Company, or it might say Mutual of Omaha. It's the same people. I call the same support staff. I talk to the same underwriters. It's all going through the same system, but it's different insurance companies. So if you're with the one insurance company, if you look at the, say, Aetna Life and Health Insurance Company, if you look at that, then they cannot raise premiums on your plan and unless they raise it on everyone of that age in the same state at the same time. But that doesn't mean the other Aetna might not be coming out with a cheaper plan than what yours is there. So that's what you'll often see. We'll group people into the same. And I think that might be your situation. And actually, these companies do kind of even internally compete against each other. Some of the big conglomerates now are owning a lot of different competing insurance companies. Either way, they win, kind of thing is the way they look at it. And they're being managed separately, even though they have the same underwriting, new business, customer service departments, a lot of that. They share those. But it's some inside baseball in the insurance business that makes it appear that way. And even more than that, you said you're under 65, and you're right. It is harder for the under 65 to find and just shop around. Once you get over 65, there's a lot of people competing, and there's a lot more options for what policies you can get and how many companies are offering them. So my heart does go out to you. But find a broker that you trust. Find someone who will tell you the truth, who's working, not as a representative of the company, but as your advocate, like our agents at Medigap360.com, or someone that you trust specifically, and they can guide you through your options a little bit better on that. But I hope that explains it. I didn't want to get off in the weeds too much, but it's a very good question, and I think that might be what's happening. But again, your specific situation, if you feel like, if you want to call in, our staff's very happy to go through and look and see exactly what it is.